Good afternoon to you, Thabiso, and to the viewers at home. Indeed, we are coming to you live from Robs Ferriera Hospital in Mpumalanga, where, of course, a beautiful initiative, as we have seen since the start of Thursday, by Operation Smile South Africa, in collaboration with the Provincial Department of Health, restoring smiles to people, young children as early as 1 year old. We've seen them coming in for the operation. We understand that at least 31 people were seen for the assessment process since on Thursday, but 16 people have actually gone through the operation, but over 200 people, or children rather, Thabiso, have been seen in the dentistry department here at Robs Ferriera Hospital. But just to speak to us more, and maybe just to clarify and explain to us what exactly is a cleft lip and a cleft palate, is Pelisa Somciza. Pelisa, thank you so much for your time and for joining us at the SABC this afternoon. Maybe if you can clarify for the viewers at home, what exactly is a cleft lip or a cleft palate?
All right, so we have kids who are born with it. The reasons for it are not really known, but research continues to happen where we're wanting to understand what causes it. But I think what's important, that and something that we're needing to emphasize, is that we always assure caregivers, or the parents rather, that it's not their fault. It's not something that they have done, but it's one of many differences that some of our kids are born with. But cleft lip, just to clarify, it's when a child is born with an opening on their lip, and sometimes it can be a unilateral where they have an opening on the one side, and sometimes it can be a bilateral when they have openings on both sides of their upper lip. And then we have what we call a cleft palate, and that's when they have an opening on the roof of their mouth. So it affects them in many ways. I know you did not ask that, but it affects their speech, how they talk. It affects how they feed. We often find that some of the patients that we come across, they are malnourished because of those reasons. But because we've been doing this work for so many years, we've since added things like a nutritional program in helping families to making sure that the kids, they pick up the weight and their development so that they can eventually get these surgeries.
Maybe if you can tell us about this weekend, how many patients have you seen? How many have been operated in the last 2 days?
All right, so this weekend was a success and something that is very assuring to us when you look at the collaboration that we have with the Department of Health in the province. So we managed to do a multidisciplinary screening for 31 patients, and of that 31, 16 were cleared for surgery. But I think it's important for us also to emphasize that those that were not cleared for surgery, they've since been put on pathways because there's valid reasons as to why they were not cleared for surgeries. And over and above that, we did a training for dentists in the province, over 26 that were trained on how to identify cleft lip and palate, and how to work with patients that come, whether in their practices or the government hospitals, how they can deal or address those issues and put those patients on pathways. And at the dental department, like you have said, we have seen over 200 patients.
And maybe for the viewers at home, the parents whose children are born with cleft, what can you say to them, especially about accessing such services?
All right, so I think it's important for us just to put it out there that our services are for free. You don't pay a single cent, and we always make sure, because we understand the communities we are working in, we make sure that we cover their transport to get to where they need to be. We make sure we cover their accommodation, their meals. So all we just want from a parent is just to get in touch with us, whether they send us a call back or they send us a WhatsApp. We have patient coordinators who are based in all these provinces that can easily, reach out to them and give them full information of what needs to happen for them to get here.
Thank you very much, Pelisa. Thabiso Somciza, Programs Manager for Operation Smile South Africa, just basically saying to us that this weekend was a success, although although they wanted to do all 31 operations, of course, because of other factors that she could not list on air at this point, they only managed to do 16. I mean, earlier on we spoke, Tabiso, to some of the mothers whose children underwent this operation yesterday. We saw them leaving earlier on this morning when we arrived, and they're quite happy, they're excited, saying that this means that their children are going to fit in when they go to school. They're no longer going to be laughed at by other children or looked at differently. So this is a great initiative, and as she has said, Upeli, so that people are welcome to call Operation Smile South Africa and just to inquire, just to call them and make sure that they're on the right path, and also just to get the information that they need, as she has also mentioned that their services are actually free. We also asked her earlier on if a person wants to go privately, how much this operation can cost, and we got a number, a figure of around more than 160-something thousand if you go private. But Operation Smile South Africa and the Department of Health in Mpumalanga give this service for free. So also it's a clarion call to people at home who have children who are born with cleft lip or cleft palate, also to make their way to Robs Ferriera Hospital, because Pelisa did say to us, Tabiso, that they're also equipping the doctors here at this hospital to ensure that these services are offered to the people around Mpumalanga. As we have heard, Tabiso, 16 patients were successfully seen between yesterday and today, and over 200 children were seen by the dentists here at this hospital. Of course, Tabiso, this program continues throughout the week as they stay wherever they are booked, as Pelisa has mentioned, where of course they do post-operation checkups just to ensure that people who received the operation are well and they are ready to move on with their lives. Tabiso?
Well, through this story, I can tell you this much: you've done well to put a smile on our face as well, and good luck to all the kiddies who are undergoing this particular operation. Thank you so much there to Nonhlanhla Jele.